think at the time of diagnosis of a cancer is a very difficult time.
The challenges that people face when they have a cancer diagnosis and when they're smoking to quit is everything else that's going on in their life.
I think they worry about being judged, and really it's a matter of being understanding and then helping them to decide that they need to stop smoking and providing them with the resources to do it. One of the biggest problems is that we know that smoking will influence on how they get through treatment. Certainly for me, if patients are having operations and they continue to smoke up to the day of the operation, we know that the intraoperative problems often are worse, their healing's often worse. We know if they continue to then smoke during the recuperation period, that healing's slowed. We know they're going to have more problems with their extra treatment, whether it be radiotherapy or some chemotherapy treatment. So there's a lot of problems there with ongoing smoking, and it's really important that we explain that to the patients, because if you do explain it to the patients, they get it, they understand that it's going to be much harder to get through everything if they continue to smoke. As a group, we're busy. Often, you're under a bit of pressure. I mean, all doctors and people who work and clinicians who work in the health system are all under pressure in different ways.
A lot of the time they expect the health professional to discuss their smoking, and I always like to talk to the patient in a private and quiet space when you can tell that they feel comfortable to talk to you openly.
Well, I would always start with the first question, do you smoke? Do you continue to smoke? When was your last cigarette? So they'd be the three ways that I would do that. And then if the answer is they're still smoking and they've had a cigarette that day, then this is the opportunity for initiating the pathway of care.
To start the conversation about smoking cessation, I think it's important to remember that patients want to talk about their smoking most of the time, and to just talk to them in a non-threatening and non-confrontational way, just as a curiosity measure to begin with. So I would say something like, how do you feel about your smoking right now? I would talk to them about Quitline. It's in their best interest for their health.
Quitline as one part of a range of referral services would be perfect for the care of the patients. And I think if we could do that in a more reliable and sort of sustainable way, then I'm sure that we would have better care for those patients.
So I think the most important thing that surgeons can do to help their patients is firstly ask them if they're a smoker. Don't ignore it. Even if you think that they couldn't possibly be a smoker, you get a surprise. Second thing is that to tell them that they have to stop smoking, or it's in their best interest to stop smoking, and that they've just got to try to do it. And the third thing is you've got to provide them with some support or a mechanism of how they can get some support to stop smoking, whether that be via using the Quitline, whether that be accessing hospital-based smoking cessation courses or individuals in the hospital who facilitate that.
I think it's the responsibility of every health professional working with patients to talk about smoking cessation and to try and help people quit smoking.
Patients do often hang on our words of advice. So I think that relationship really means that they will listen to what we say. So I think that's a really important part.